It is a pleasure because tonight I'm interviewing Dr. Alan Goldhammer, a big influence back in like 17 years ago when I started natural hygiene and I started studying fasting and a healthy lifestyle. I read his book, The Pleasure Trap, like 17 years ago, or maybe 16 or 15, and it helped me a lot. And his contents, the lectures always motivated me a lot, and it is a pleasure to interview him and share uh, his knowledge with you, with all my listeners. So, please introduce yourself a little bit, Dr. Goldhammer.
Well, sure. I'm the director of the True North Health Center in Santa Rosa, California. And True North Health has been here for 40 years. We've helped over 25,000 people undergo medically supervised water only fasting. And so we work with patients that have conditions like high blood pressure and diabetes and autoimmune diseases and some forms of cancer like lymphoma. And we have them go through water fast as long as 40 days. And then we teach them to eat a whole plant food, salt, oil, sugar-free diet in order to sustain the results long term.
And you probably have seen many things that would be considered impossible or like a miracle these last 30 years, 40 years of practice.
Well, in fact, routinely every day we see patients with conditions, as I said, like high blood pressure or diabetes, where if you undergo medical treatment traditionally, you're told from day one that you'll be on drugs the rest of your life and that you'll never get well. That getting well isn't even part of the paradigm. People are essentially doomed to sickness forever and on drugs forever, along with their side effects like chronic cough, fatigue, impotence, and even premature death. Whereas with this type of very natural approach, first, the body's able to heal itself with fasting, eliminate the causes for why they developed hypertension and diabetes. And then they're able to sustain those results using diet, sleep, and exercise in order to maintain health long term. So it's a completely different experience. In fact, the residents that train here at our facility often make a comment that it's the first time they've ever seen anybody with these conditions get well.
And should be the norm instead of like the exception, right? But uh, nowadays treatment is not the norm. So can you tell us a little bit about why fasting? How did you got into fasting, and why would it be better than the usual conventional treatment?
Well, the conventional treatment has nothing to do with dealing with the reason why people are sick. The reason people are sick is because their brains are being fooled by chemicals put in their feed, so they systematically overeat. And when they overeat, they become obese. And when they become obese, part of that fat is visceral fat. And visceral fat essentially is like a tumor, and it produces inflammatory products like IL-6 and TNF alpha and acute phase reactive proteins, and it leads to heart disease, cancer, diabetes, and autoimmune diseases. And so traditional treatment has nothing to do with getting rid of the reason why people are overweight and have this visceral fat material that's behaving like a tumor. And so what we do is we recognize that the salt, oil, and sugar are chemicals that are put into the feed that stimulate dopamine production in the brain that induces pleasure and causes overeating. And we stop that. So we get people eating a whole plant food, SOS-free diet. And then we use fasting to give the body a chance to preferentially mobilize this visceral fat and eliminate it. And then after fasting, get people on a healthy diet so they don't regrow this tumor.
Nice, nice, nice. So when they want treatment, they usually go to the True North Health Center. How do you start the treatment in a patient actually?
Well, there's, every patient, whether they're going to be fasting at True North Health Center or fasting someplace else, like for example, some people have local physicians that will support them and our doctors can work with them remotely. Some people will come to the center and stay with us at our 70-bed facility. Either way, though, that everything's the same. First, you have to make sure a person's an appropriate candidate for fasting. Not everybody is. And the way you do that is through a medical history, a physical exam, and basic laboratory testing. That gives you not only the ability to tell who's a good candidate for fasting, but then it gives you markers you can use to tell the difference between a good thing that's happening during fasting and a problem. So history exam and lab are critical components. Then during fasting, Appropriate monitoring is important. At the True North Health Center, we monitor people twice a day. We take their vitals. We make sure everything's working the way it's supposed to be. Then after fasting, it's important that appropriate refeeding take place. One of the mistakes people make fasting when they're not at True North Health Centers, they're too active and they can become dehydrated. And so that can become a serious problem. Or when maybe they do the fast properly, but they come off the fast too rapidly. And when people come off the fast too rapidly, especially on a longer fast, you can get very sick. You can get post-fasting edema. You could even get refeeding syndrome, which could be serious or fatal. So it's important that if you're going to do a long-term water-only fast, you do it in a restful state, you have appropriate monitoring, and you come off it in a progressive way. It takes about half the length of the fast to terminate a fast appropriately.
Nice. But in more than 30 years, you guys are open, right? And you never had
40 years.
and I remember you saying like everybody that comes in walk out of here well. Nobody died yet, right?
So far, we've had 25,000 patients walk in for fasting and 25,000 people walk out. And we're very picky about that. We're trying to maintain our safety record. So we tend not to take people that are not good candidates for fasting. We monitor people properly when they do fast, and we make sure they terminate their fasting appropriately. And so far, it's worked out very well. In fact, we've published a fasting safety study that looks at adverse events in long-term fasting and shows, what symptoms do show up and what can be done to recognize those things and avoid those problems from becoming serious.
Nice, nice. I actually read all the scientific papers published by you guys, by True North Health Center and you, and I actually quote in my fasting book and I quote in my lectures. I use the studies to reference. So I admire a lot the work because not too many people around are doing actually scientific work on fasting, on hygienic fasting, right? Because there's long goal, there's some scientists studying fasting, but I think although they are ahead of everybody, they're still behind the hygienic perspective, right? Could you talk a
Well,
little
there's
bit?
intermittent fasting and fasting mimicking approaches, which are very common. And then there's long-term water-only fasting. We're one of the few places that's actually researching long-term water-only fasting right now. Walter Longo has published a wonderful book on fasting, who talks about intermittent fasting. And we have a new book called Can Fasting Save Your Life that's coming out in June. And it reviews all of the scientific literature on fasting, as well as the protocols necessary to conduct fast safely, so that physicians would have a good guideline, clinical guideline, to help them if they were going to try to assist a patient in long-term fasting. We also have a telemedicine practice where we have a number of our doctors that have experience in fasting. They're available to coach doctors as well as patients if they're going to be fasting patients, away from the True North Health Center. It was interesting. Walter Longo, in his book, suggested don't do long-term water-only fasting because it can be too dangerous unless you do it at the True North Health Center. And since I evaluate other researchers' intelligence based on how much they agree with me, I consider him a genius.
I have to say that I already heard that one in other lectures, but like it's always funny to hear that because maybe we're visionaries or we hygienists are seen as crazy, right? Quacks or anything like that, but like I think we are visionaries.
We've gone from being criminal quacks when we started out in 1984 to being cutting edge researchers today, as we've published 18 papers in the peer reviewed journal. So it's getting a little bit better.
Yeah, that's for sure. So what would be a contraindication to fasting? What would be like a disease that you guys wouldn't accept it or depend on the case?
The contraindications to fasting are many. If a person has excessive fear of fasting, if they don't really understand fasting, that's going to be a problem. If they're on medications that can't be safely withdrawn, for example, if they have atrial fibrillation or they've had a recent myocardial infarction, pulmonary embolism, deep vein thrombosis, and they're on anticoagulant therapy, you wouldn't fast people on medications, particularly not anticoagulant medications. And you wouldn't just arbitrarily discontinue them because that could be associated with induction of stroke or other problems. So medications have to be weaned safely and appropriately in appropriate patients. So contraindications would include any disease process where the medications couldn't be safely withdrawn. If people have severe kidney disease, their creatinine levels are, for example, over 2.0, you probably wouldn't do water-only fasting because the kidneys are an important part of the detoxifying process. And if their function isn't adequate to handle the vigors of fasting, they could shut down and become a problem. If you have people that have anorexia nervosa, which is a neurological, neuropsychiatric condition, they probably would be poor candidates for fasting, though they may want to fast. If you have people that are in a cachexic state and have deficiency problems, they're not going to magically disappear because you're fasting. So lots of different conditions would be poor candidates for fasting. And so it's important that medical history exam and lab be used to differentiate those people that would not benefit from long-term water-only fasting from those that would. On the other hand, there's also a lot of conditions that benefit from fasting, not the least of which is obesity. And at least in the United States, about 3/4 of people are now overweight or obese, and it's increasing every day. And with this obesity, this subcutaneous fat goes along with visceral fat, and elevated visceral fat is one of the major threats to health. It makes you more vulnerable to dying from virtually everything, including like COVID-19 infections and other kinds of acute infections. It's often not talked about, but obesity itself is one of the major risk factors that's often ignored. So the other indications for fasting, besides the desire to preferentially mobilize visceral fat, is dealing with the diseases of dietary excess. So high blood pressure, diabetes, autoimmune diseases. These conditions all respond well to appropriately administered fasting, as does some forms of cancer like lymphoma. We've recently published not only a case report in the British Medical Journal, but a 3-year, and now we have a 10-year follow-up on patients who are able to not only overcome their disease, but are able to maintain their progress over the long run. We've done that in cardiovascular disease like hypertension as well. We did a study with our colleagues from the Mayo Clinic. We took 29 patients with hypertension, 28 people at 6-week follow-up were able to sustain their normal blood pressure without medications. And at 1-year follow-up, 75% of the people were able to maintain their weight loss and drug-free state with normal blood pressure. So it does show that people that are highly motivated anyway are able to not only get well, but they can stay well if they're willing to do dangerous and radical things like eat well and exercise and go to bed on time and possibly undergo fasting.
Yeah, so can you talk a little bit more about like what would be a healthy lifestyle? Because when we talk about like eating well and sleeping early and chronobiology, chrononutrition, a SOS free diet as you guys call, people really don't get it. Could you be more specific on these? Eat well, sleep well.
Yeah, well, diet, sleep, and exercise are the critical components to health. And diet, we advocate an exclusively whole plant food diet that's SOS free. SOS, of course, is the international symbol of danger. And it stands for the chemicals added to food that fool the brain and make us fat. And those chemicals are salt, oil, and sugar. Salt, though essential nutrient, when it's used in concentrated form, added to the diet, it stimulates what's called passive overeating. It's one of the reasons people are fat. Even though there's no calories per se in salt, it still results in artificial stimulation of dopamine in the brain that leads us to overeating. Sugar, most people recognize as empty calories. People eat it as much as 150 pounds a year of this chemical. And it stimulates insulin production to increase, which drives sugar even lower. And then, of course, people get cravings and binges and are having all kinds of difficulties. It alters the gut microbiome, which is an important part of our immune system. And the extra calories make us fat. And of course, oil, like Dr. McDougall says, the fat you eat is the fat you wear. You might as well just rub it on your belly and hips, because that's where it's going to end up. So whether it's any kind of oil, including olive oil, needs to be, from our viewpoint, excluded from the diet. And if you do that and you eat large quantities of low density but high nutrient density foods, so low caloric density, high nutrient density foods, you can achieve your optimum weight. You can get the vitamins, minerals, protein, fiber, and carbohydrates that you need. You can avoid the dietary excesses that lead people to be sick and suffering needlessly. You also need exercise, so you need to develop, flexibility, strength, balance, and aerobic capacity. So walking, hiking, biking, swimming, these are things that need to be done on a daily basis. And you need sleep. You should go to sleep in a cool, dark, and quiet place and get enough sleep so you can wake spontaneously feeling refreshed. If you have to wake up and use a highly addictive nervous system stimulant like caffeine in order to be able to function, you're not getting enough sleep.
That's true. That's true. So do you guys teach people that go to the True North Health Center how to live healthily before getting there and afterwards. So they, they prep for the fast, and then after the fast, they can maintain the habits, the healthy lifestyle.
We do. We have a free Roku channel with a lot of content on it, True North Health. We live stream our lectures 3 times a day so that people not only at the center can participate, whether they want to participate live or not, but also remote patients are able to go into our website, truenorthhealth.com, and participate in our educational outreach. We publish articles in journals like Health Science Magazine, and we've published, as I said, over 18 peer-reviewed articles and case reports in the scientific literature. We have our book, The Pleasure Trap. We have a number of vegan SOS-free cookbooks, like Health Promoting Cookbook and the Bravo and Bravo Express cookbooks. And we have our new book coming out called Can Fasting Save Your Life, which is a really excellent overview of everything about fasting that people need to know in order to get and stay healthy.
I think besides talking about fasting and talking a little bit about diet right now, is that most people don't understand why no oil. Could you talk a little bit more about that?
Oil is highly processed, fractionated food byproduct. It's not actually food. It's a byproduct concentrated from food. It has 9 calories per gram. And it's very difficult to include oil in the diet without ultimately gaining extra weight and suffering health consequences. Oil is a highly processed food, so you get a peroxidation process that occurs as soon as you break it down. When you shove that in your mouth, like I said, you might as well be just rubbing it on your belly and hips, because that's where it's going to end up.
That's true. That's true. And how long have you been practicing hygiene, living this way?
Well, I'm 65 years old, and I became fully committed to a natural hygiene way of lifestyle as a teenager. So I've had approximately 49 years of living hygienically. So next year should be 50 years. So we'll start the second half then.
I'm only 17. If I could go back, I would be born this way. But we end up learning too late. But so what else? Because you guys probably have seen many things. I read the paper on the lymphoma case, that 21-day water fast, and I read the follow-up. I haven't read the new follow-up of 10 years. But what else have you seen here that is people actually think it's impossible, or like, and afterwards, why a 40-day water fast would be better than a 10-day or 20-day water fast?
40 days isn't always better. And you want to fast long enough to get the problem resolved, but as short as possible. The idea is not to try to set a record every time you go out and do a fast. You have to fast within the reserves of the individual and motivated by the case. In some cases, 40 days isn't enough. We had a recent lymphoma case that was a stage 4 lymphoma with metastasis into the bones. We fasted him 40 days, and although we got a lot of improvement, we had to then follow up with another 40-day fast 2 years later. And now, of course, he continues to do very well. The reason you haven't read the 10-year follow-up on that British Medical Journal case is because it's part of a cohort. We've done a series of papers, and that has been accepted for publication. It will be coming out in the summer. So you'll be able to read all about her long-term follow-up, as well as other patients' remarkable outcomes with lymphoma in an upcoming journal. So we see, thousands of patients with a variety of conditions. Much of what we see is cardiovascular disease, so high blood pressure and all of its consequences. We see a lot of type 2 diabetes that do well, normalize their blood pressure, blood sugar, and recover their health. We treat a host of autoimmune diseases. Autoimmune diseases are diseases where the body begins to attack itself. For example, rheumatoid arthritis. It's your body that's attacking your joints that cause the deformity associated with rheumatoid arthritis. Ulcerative colitis, ankylosing spondylitis, lupus, asthma, eczema, psoriasis. These conditions all do very poorly under conventional medical treatment. The conventional medical model recognizes the immune system's attacking itself, and so their answer is let's shut down the immune system. And at first, that's like a dream because you feel relief of pain. But then it becomes a nightmare because it turns out you need your immune system. And when you shut it off, you end up with more problems sometimes than what you actually started with. Our approach is not about shutting down the immune system. It's about eliminating the irritation, like the gut leakage and other factors that stimulate the immune system to begin attacking itself. We do that with fasting. And once you normalize that whole response and allow the gut microbiome to regrow, get rid of the gut leakage and the inflammatory oxidative damage from the poor dietary choices, the body's able to heal itself. And then when you go on a whole plant food SOS-free diet, it's able to manage those results and sustain those results over the long run.
Nice, nice. It's just that, for example, in my case, I had terrible back issues. And even with 16 years of living hygienically and several water fasts from 24 to 5 days, I haven't had my back heal as much as the last one I did like 1 year ago, a 40-day water fast supervised. So I'm always interested. Unfortunately, there's no research on it, right? But why the body can manage to heal deeper, heal more after a long fast instead of shorter fast.
I think the body's healing every day. And if you heal faster than you age and deteriorate, you get well. And if you age or deteriorate faster than you heal, you age and get sick. And so more fasting, longer fasting just gives more time for the body to do what it's naturally trying to do. Obviously, that's limited by the reserves of the individual. You can't fast. Not everybody has 40 days worth of reserves that they're able to utilize to do fasting. So sometimes you have to do several shorter fasts to get the same kind of clinical results. Sometimes you have to do several longer fasts, depending how much the problem is. And not all problems are going to resolve with fasting. In other words, the problems that are caused by dietary excess, problems that are associated with inflammation, these are more likely to respond than where there's mechanical problems or there's been structural defects or there's genetic defects. So we tend to focus our experience on the patients that have conditions that we know from experience are likely to respond. And we tend not to deal with, say, a neurological problem that's unlikely to be associated with dietary excess because its likelihood of responding is going to be reduced.
See, nice answer. I'm a fan of fasting, and I plan to do another 40-day water fast because I felt my back heal as better than anything I ever did. So I plan to do the next one in True North. It would be a pleasure to be over there, get to know the center, and also do another 40-day because I feel my neurological system a lot better after these 40 days, way better than the 24 that I did. And I think if I did another one, it could get even better. I admire the work you guys are doing because it's, like cutting edge and nobody sees it, right? Like it's not recognized as it should.
Well, hoping that's going to change with the release of our new book. It'll hopefully get a large audience and a lot of this information will get out and give people a chance to really see what the body can do if you get out of the way and give it a chance to do its thing. Some people ask us, why do we fast 5 to 40 days? Why not longer? And the truth is that hygienic doctors used to fast people longer, 60, 70 days, even longer. Dr. Burton, the guy I studied with longest fast was over 100 days in a patient. And I asked him, this was 40 years ago when I went there to train. I said, Alec, how come you're not fasting people over 40 days? And he says, because of the sleep deprivation. And I said, oh, do they have trouble sleeping after 40 days? He goes, not the patients, me. And the fact is, after you get into the fast farther, when you do a really long fast over 40 days, the electrolyte balance, everything is a lot more delicate, and he would worry about patients. So he decided he would stop the fast at 40 days with a few exceptions, but generally that was the end of it. So Moses, David, Elijah, Jesus, and our patients fast up to 40 days. I try to tell the patients they're in good company,
I always laugh a lot with the jokes that Herbert Shelton does during his lectures that are available on the audio are available on the internet, right? And he's quite a funny guy. And I remember Alec actually telling a story about a fast that Shelton did in a child of 2 years and a half of age, 2 years old, and he fasted the boy for 40 days or something like that, and I was like, wow, can a 2-year-old boy fast for 40 days?
I've never seen that necessary. Honestly, kids usually respond much quicker. Most of the fasting done in children is done very briefly, and you need to be extremely careful in the very young and the very old about hydration. Dehydration is a very real concern, and so and it isn't just solved by drinking water. In other words, you have to maintain fluid, but you also have to maintain electrolytes. And so I'd be extremely concerned about a very long fast in a 2-year-old. In fact, I would really question that because I've looked at all of Shelton's material. I don't recall a case of a 40-day fast in a 2-year-old. That would be extraordinarily exceptional.
I agree. I'm not suggesting anybody to try to do something like that, but I remember actually in the lecture that he gave for the NIH, the Hygiene Society lecture that you guys have, the event that you guys have every year,
IHP,
right?
the International Association of Hygienic Physicians, the IHP.
Exactly, exactly. He gave, I think the lecture was in 2015 or something like that. It is quite old, but I remember, and I actually look up the internet and I saw like pictures of the boy. I think I still have the picture, like several pictures with some writings on it. But still, like, I'm not suggesting anybody to fast that long a child, that's for sure. But it's quite impressive still. So, could you tell a little bit more besides fasting and B12? What do you guys suggest for patients?
Well, the only source of B12 in nature is bacteria. And so, people that are getting a lot of bacterial exposure don't really have a problem with adequate B12 levels. But vegans, for example, meat eaters, if you took a pile of ground meat, for example, and separated it into meat cells and fecal cells, you'd find plenty of feces in every pile of ground beef. And with all that feces comes a lot of bacteria and a concomitant B12. So if you're a meat eater, it may not be quite as big of an issue. But if you're a vegan and you're not eating meat, fish, fowl, eggs, and dairy products because you want to avoid bacterial contamination, you want to avoid parasites and worms, you want to save the planet, you want to affect climate change, you want to go to heaven because you're not being a cruel person, whatever, you may need to supplement vitamin B12. We recommend 1,000 micrograms of methylcobalamin a day. It's a very tiny amount. It would fit on the head of a pin. It doesn't take a lot, but it will make sure that you don't develop pernicious anemia or megablastic anemia or have problems with B12 deficiency. The other supplement for people that don't go outside, which unfortunately is a lot of people now, they can develop vitamin D deficiency because you form that from the sun. If your vitamin D levels are too low, sometimes we'll supplement vitamin D as well. But mostly we try to avoid the pills, potions, powders, and treatments because they often do more harm than good.
Nice, nice. So you guys don't worry about omega-3s, for example, or do you guys suggest flax seeds for the patients?
Well, we worry about everything, but we encourage people to use walnuts, flax seeds, nuts and seeds, lots of green vegetables. And for most people, that seems to maintain adequate levels of DHA. If they don't, if there's problems, then of course you can now use a vegan supplement of DHA, which is not the problem that it used to be where you had to grind up fish oils and things like that. So, most people are able to do well with rich vegetable sources. If you're concerned about that, or if there's testing that suggests there's a problem, then there are reliable vegan DHA supplements now so that you can take it preformed.
I see. And iodine, because those are usually the nutrients questioned in vegan diets, for example. Even there's some
iodine is not necessary for plants to survive. So if you grow all of your food in Minnesota, where the soil is naturally deficient in iodine, you would develop iodine deficiency. And you have a few choices. You can include some sea vegetables in the diet, like kelp and nori sheets, things like that. Or you can supplement iodine. Personally, I like to use small amounts of sea vegetables in the diet. You get lots of iodine and other trace minerals. But some people are concerned about biological contamination of the oceans, whatnot. And as a consequence, they'll prefer to supplement iodine. Nowadays, people that get their food grown on the coast where the soils are not deficient in iodine typically get enough iodine in their diet. Iodine is present in vegetable-based diets, and that with small amount of sea vegetables seems to take care of virtually everybody. But if not, iodine supplementation is certainly simple enough.
Nice, nice. And what would be your routine, healthy routine for people to understand, like how do you live, like in terms of exercise, sleep, diet, and even fasting? That's a curiosity for me as well because I
Well, I'll tell you
remember.
what I can tell you what I do, but what I do isn't what I say in every instance. For example, I play basketball. I love basketball. I play basketball 4 times a week. I played this morning. I'll play tomorrow night. Um, Really, what I recommend is that people engage in a variety of activities: walking, hiking, biking, swimming, dancing, rather than just do one thing. If you do the same thing, you have more vulnerability to overuse injuries and all that kind of stuff. My problem is I like basketball so much that I'm willing to take that chance in order to be able to spend all my available time that I can spend exercising doing that particular thing that I happen to like. But I'm on the spectrum, so everything I do I tend to do to an extreme. I got interested in fasting as a teenager, and that's all I've ever done since then. I've been fascinated with that. I got interested in basketball in fourth grade. I haven't stopped playing basketball since then. So I'm particularly tend to extremes. So I don't recommend that, but that's what I do. I eat a whole plant food SOS free diet. And, fortunately I work at True North Health Center. So I get most of my meals prepared there, which is great. And what we don't do, we do the same thing at home. We have a couple acre farm where we grow food for True North Health Center. And so we have readily available organic produce all year round. I live in California, so it's a wonderful place to get good food. I don't eat 3 to 4 hours before I go to sleep at night. So I'm getting 12 to 16 hours of fasting every day. I usually exercise vigorously in the morning, playing basketball before I have breakfast. So that gives me a 12 to 16 hour fast every single day. Once a year, as much as I hate it, I take time off. I do a fast. I don't like it because you have to rest. You can't play basketball. My wife, Dr. Moreno, is mean. She takes my computer away so I can't work. It's a bit of a torturous time, but I don't get any symptoms because I've been doing this since I was 16 years old. So I never smoked or drank or had a cup of coffee or did any of these things to undo. And so I've been living a hygienic lifestyle. So fasting is relatively boring in the sense that nothing particularly interesting happens other than, I do get a rejuvenative effect. So I think it's highly beneficial. I recommend it. I do it. The staff at True North Health Center take fast periodically. We do it preventively. And we've done a study recently that showed that as helpful as fasting is in sick people, affecting things like cardiometabolic risk factors, proportionally, it actually is more effective in healthy people even than sick people. It may be the people that get the most benefit from periodic fasting are actually healthy people doing it preventatively. I mean, it's a novel concept, but our idea is to do stuff before you get sick and fall apart so that you can delay, defer, avoid getting sick and falling apart until you've lived your good life, and then one day you go to bed and don't wake up and have a good death, rather than spending the last 20 years of your life unable to talk or move, lying in some nursing home bed, waiting for people to come and change your diaper.
Yeah, sad but true. Sad but true. The world's not ready to understand it, but sad but true. I have seen my father die of cancer after 10 years of me living a hygienic lifestyle. In his last days, he was like, "You were right. I want to become, like a hygienist," but it was too late. He had metastatic cancer in 4 organs, so it's sad, but the world won't understand. Can you name the research that you guys published on that fasting actually helps more healthy people than sick people?
There's a paper coming out. If your readers are interested, they should go to our website, truenorthhealth.com, and they can see all of our studies there. And you can see there's a study that's done on, we found metabolically healthy, it happened to be females. And we did an evaluation of the cardiometabolic changes in those healthy females. It was very hard to find metabolically healthy people because only 12% of the population are now metabolically healthy. Even people that don't look like they're overweight are often over fat. They have too much visceral fat, or they are not healthy metabolically. And so the percentage of people that are actually healthy now is getting smaller and smaller, getting harder and harder to recruit for studies. You know, where we found most of them, actually, there were employees that work at True North Health Center. They're the ones that were testing out as metabolically healthy. I found that to be more than just a coincidence.
They agree with the concept, and they actually are being fed over there, you know, like, so it's probably hard.
We do provide healthy meals to our staff, and close to 20 of our staff live on site, and so they get all their meals there.
I hope to intern there one day, right? I'm a nutritionist. At least back then, you guys were not accepting nutritionists because I checked, right? Maybe you guys will accept.
Yeah, someday. Right now, we have limited capacity. We take MDs, DOs, DCs, PAs, and nurse practitioners, people that are primary care doctors that are able to do fasting supervision. So that's our current focus. But I think we should begin having a nutritionist training program, because nutritionists would do wonderful to see, you know, the recommendations applied. Most nutritionists have frustration because they know what to tell people to do, but it has trouble getting people to do it. And so they don't get to see all the benefits, because the problem with nutrition is you actually have to do it. You can't just think about it or talk about it or have good intention. You actually have to shove the stuff in your mouth and not shove the other stuff in your mouth. And that's what it takes to get the results.
That's true. I'm glad that because most people that follow my work, and, you know, are already into adopting a natural hygiene lifestyle and diet. But like, I see that every day. Most people that are not into it, they are hard to accept it. But so what do you guys feed people in True North Health Center? For sure, a plant-based diet, SOS free, but like in what
So
sense?
in the morning, we have a fruit bar, salad bar. So there's lots of fresh greens, lots of fresh whole fruit. Oftentimes there'll be grains like oatmeal or a corn syrup. There may be steamed squash or steamed vegetables. So people, it's more of a buffet style. They can get the things that are appropriate for them depending on where they are in their recovery phase, or if they're just doing a healthy eating program. Some of our patients are not fasting patients. They come for healthy eating programs rather than water-only fasting programs. And then at lunchtime, again, we have a huge salad bar, lots of great stuff. Of course, it's California. We've got our farms. We buy from local farmers. We get from the San Francisco farmers markets. It's really a fabulous place for being a vegan, because there's just such good fresh food available. And then we have a hot bar where there'll be steamed vegetables and starches and Hubbard squash and butternut squash or soups or other things like that. And then dinner is very similar, where, again, salad bar, steamed vegetables. So people, depending on where they are in the program, they're able to get what they need. You know, the staff eat their meals there, and you can always tell the staff members, because they have these huge plates, and you're worried they might hurt their back carrying their dinner to their table because it's just so much food. But this is high nutrient density but low caloric density food. So you have to eat a lot in order to get enough, especially if you're active. You have to eat a lot of food. So it's good and it's bad. It's good because you get to eat all you want, and it's bad because, you know, it takes some time to chew all that food up. And you can't, it's not like going through a drive-through where you get 2,000 calories of grease and slime. You can shove it in your face before you hit the road. You got to sit down, relax, and enjoy your meal. So we spend a lot of time, you know, eating. But the good news is, because we're at True North Health Center, we have this fabulous group of employees, the chef, the sous chef, and all the kitchen workers. So you have this fabulous food prepared. All you have to know, it's time to eat, boom, and you're back in the dining room. So it's a continuous process of eating over that 8-hour window, making sure you get enough food in.
Nice, nice. It would be a pleasure to get to know the place one day, and I recommend it to all my patients that want fasting, and everybody that comes to ask me. I always say that the place, although I don't know the place in person, I have never been there. For everything that I read, for all the, you know, the correct way of the publishing the papers, the scientific work, and, you know, all the lectures that I heard from you, I recommend highly to everybody as the best place to do a hygienic fast, to do a water fasting in the world, right?
If your viewers have a question about whether fasting is appropriate for them or what's going on at the center, we offer a free phone conversation. They're welcome to go onto our website, complete the registration forms. I'll review their medical history and be happy to talk to them. There's no cost. They just give them direction and pointing if fasting is something that needs to be, a legitimate consideration for them.
Nice, nice. And one last question, actually, two last questions. One, have you ever done a really long fast? And just curiosity. The second question is, I know your take on that, but I'm just asking for the reader, for the listeners, and what would be your take on like a raw food diet and a frugivore diet? I have been a frugivore, a raw fooder for 17 years, right? And Shelton and some of the old hygienists would suggest that fruits and vegetables are like, the staple for man's diet because, anatomically, biologically.
Right. If you're going to do a raw food diet, you have to get enough calories. That's the one thing. But you need to make sure it's not just fruit. You need to get enough vegetable material, raw vegetable material, because just fruit, particularly modern hybridized fruits, very high in sugar, very low in mineral content. And so people that eat fruit only tend to get problems with mineral balance, and they'll develop teeth, nail, hair, or, emotional volatility. They'll develop problems over enough time. It's not that fruit is bad. It just isn't a complete material. And that's why the trick is the people that do well on fruit only are the ones that get enough vegetables in. It's actually easier to include some steamed and starchy vegetables in the diet in terms of getting that mineral balance, just because the volume of food you have to eat as a raw foodist is extremely high. It's high enough even mixing raw and cooked. Keep in mind, though, by volume, most of this diet is raw no matter how you put it together. You're talking about a couple pounds of fruit and salads a day. And then, either getting more raw materials in volume, usually they're using blenders and juicers and processing food that way, or you process it with steam. I prefer to recommend steam because I find that works out really well. It's a more practical diet for people. It's a little bit less elitist in the sense that you can, the cost per calories for raw fruit and vegetables is 10 times as much per calorie as it is steamed and starchy vegetables. That's why the people in the world that make less than $5 a day, which is 2 or 3 billion people, live on rice and beans and vegetables, because that's the least cost per calorie. So to just arbitrarily say in order to be healthy, you have to eat all raw fruit and vegetables, that's not true. It doesn't mean you can't do that. And if you have the ability to get access to that and you have the time and you're willing to get enough vegetables and so you maintain health, great. But that's not what a lot of raw foodists do. What they do is they eat a lot of dried fruits, fruit juices, lots of nuts, and then they end up getting sick, and we have to deal with that. So if you're going to do, and I have seen it done healthfully before as well, but again, those are people that are usually very mindful of getting really high quality fruits and vegetables, and particularly emphasizing vegetables in volume in the diet. So most patients I find are better served eating large amounts of raw fruits and vegetables and enough steamed starchy stuff so they don't get too skinny. That's essentially what it comes down to. We limit nuts and seeds to about an ounce a day. We want to get about 15 to 18% of calories from fat, 10% of calories from protein, and the balance from plant-based carbohydrates. Again, whether it's raw or cooked, is not as important as what the actual integrity of the food is, as far as I'm concerned. And on some nutrients, for example, steamed vegetables are actually more available than raw. So the idea that cooked foods are dead foods or whatever, Terry Fry's carryover ideas or something, I don't think are well substantiated. Now, as far as fasting, yeah, I fast every day for 12 to 16 hours. I fast every year for a week, assuming that nothing interesting shows up. I have had to do longer fasts in the past. I got bitten one time by a person in basketball. Actually, my elbow seemed to hit their mouth, but I got a human bite. And instead of being intelligent, which is when you get a human bite, you clean it out really thoroughly. I finished the game and we won. But nonetheless, I ended up with an infection and I didn't want to resort to using antibiotics. So I fasted. I fasted, until it resolved. It took 9 days of fasting for that to resolve. And, that's the longest fast I've had to do in recent years. But again, I've been fortunate enough to be having started this, never having been sick, never having had problems, never having had bad habits. And so, hopefully I won't ever need to do any of the marathon fasts that I'm doing in patients that, haven't been as fortunate to, avoid all of the downfalls and pitfalls that so many people run into.
Nice, nice. I agree with the raw food, everything you said about raw foods, and for sure, I always suggest patients and readers and followers to eat a lot of other foods beside fruits and eat great quantities of vegetables every day, every single day, like also mushrooms, also algae. But for sure, I base my diet on fruits, but I'm not in terms of calories, but not in terms of volume. In volume, I eat like peas and even sprouted lentils and sprouted chickpeas. I agree completely with what you said. And any last tip, suggestion, motivational that you want to give to our listeners, and also how can they find you, the book, and apply to a fasting on True North Health Center?
Well, truenorthhealth.com is the website. They can fill out registration forms and get a free phone consult with me to discuss, if it's an appropriate option. They can read our book, The Pleasure Trap, Mastering the Hidden Force that Undermines Health and Happiness, and they can read our new book soon called Can Fasting Save Your Life? They can go onto our website and get them free access to our live streaming, our Roku channel, all of our articles, everything's available online, ready to go. And, remember, health results from healthful living. So if you want to live healthfully, that's the price you're going to have to pay if you want to be healthy. So, live healthy, eat good, exercise, sleep enough, and if it's appropriate, do some fasting.
Nice, nice. That's pretty good. Just one last thing, if I can, I would like, I don't know if you would read one day, but I would like to give you a copy of my Hygienic Fasting Nature Surgery. It's like I gathered together everything in terms of science, even some of your research, like the blood pressure, some of the Walter Longo research. I gather a lot of information of Shelton and other hygienists, and is available on Amazon on print on demand. So I could send you your way if you like it. It would be a pleasure to have you read my book. I have been only doing this for 17 years and not 50. I remember you talking about being the ancient one with your grandchildren. So it was a pleasure to interview you. You have a fan over here in Brazil. I have been following the content for these last 17 years, not just you, also all the other medical vegan doctors. I'm always updating in the scene. I'm the same as you, but with tennis. I don't know if you know, but racket sports are being seen as the longevity sports. So yeah. There's like increasing lifespan and average lifespan, life expectancy for 10 years with racket sports, even more tennis than badminton and the other sports. So, but I'm the same as you with sports. So with tennis, if I can play tennis, I don't mind doing anything else. But I always tell people to do cross training and change sports, But it was a pleasure. I hope the True North really reach out for everybody on the planet, because I really agree with you. Healthy people should be the norm and should be also doing fasting. So it's not just for sick people, it's for everybody, because it's, we have too much food every time of the year nowadays, and we never go through a caloric restriction or period of fasting. So even for us, living really healthy, it still is really important. And I love your work. I admire a lot. And as far as I can, if you ever need anything to spread the word of True North, come with me, because it would be a pleasure to spread works that I believe, and I know that it would be really positive for humanity.
Excellent. Well, it's nice to meet with you. Thank you for getting the word out.
See you guys, everybody. And I put also the video on the Portuguese channel with subtitles and dubbed or dubbed. See you guys.